So the step one, guys, is in a nutshell, as you'll see in the first aid or on the actual USMLE website, 8-hour exam. It's composed of 7 blocks of 40 questions. You get 280 questions in total. Each of the block has 40 items. It's 60-minute long, and you have 45-minute plus minus 15 minutes if you skip the tutorial of breaks. You cannot really take a break in between, like you cannot take a break in a block, but you're allowed to take breaks in between the block. So this is also a very important component of your plan when it comes to actually taking the exam, but we'll talk about this in a bit more detail afterward. Now, Chris is going to show you just a sample USMLE question just for the format, as well as talk to you about what is actually tested in the step one.
Yeah, so what we can see here is the basic outline of what you will be faced when you take the exam or when you will take practice exams. So what you see here on the sides are going to be the 40 questions. And this is just one of those questions. As you can see, it's basically some sort of case study where they present you with some sort of case. At the end, they have a question and they try to ask you something about it. They're going to be 40 questions times 7 because there are 70 blocks. So in total, 280 questions. You have 60 minutes per block, as Jose said. So that makes about 1.5 minutes per question. Let me move on. So now, when is it the best time to take the USMLE exam? So if you're looking at our situation, First Faculty of Medicine, you have to know, first of all, that in the US, the students usually take it at the end of the, second year. But because medical school in the US is only 4 years long, and for us it's 6 years long, we can't directly take it after 2 years because the curriculum is not the same. So for us, the basic question is, should we take it at the end of 3rd year? Because there are some students who are taking it at the end of 3rd year, or should we take it at the end of 4th year? I know that there are some people from LF3 also. You will have to look at what subjects you're covering in each year, but I know from people that some people usually take it at the end of 5th year because you have different curriculum. But in order to make the decision, what we are basically looking at is what is actually going to be asked on the USMLE Step 1 exam. So as you can see here, pathology constitutes a very large portion, the biggest portion in the USMLE exam. With pathology, they also mean, of course, pathophysiology. Actually, the pathophysiology part is much bigger. They will almost never ask you like only what's the diagnosis. They will ask you some sort of like pathophysiological mechanism, more to that later. And you will usually have to cover after 3rd year. After 2nd year, you already have physiology, you will have biochemistry. And now, me and Jose, we took the exam after 4th year. Why didn't we do it after 3rd year? Because one could argue that after 3rd year, you're very well prepared. You just finish your pathology exam. You still have somehow physiology, etc. in your head. And the longer you wait, the more you will forget. That's natural. But this has one downside doing it in your 3rd year is that you will have covered, that you won't have covered at least 25%. So we're looking at pharmacology, we're looking at behavioral science, psychiatry, and this was basically the main reason why Jose and I did it after our 4th year, because pharmacology does constitute almost a quarter of the exam. It's a very hard exam. You need some time to study for it. There are some people who study it by themselves at the end of 2nd year in their summer. You can also do that, but you just have to know that you have to do it on your own. Again, Jose and I, we just did 4 years of our curriculum and then prepared for the USMLE exam. All right, let's move on. So, what is a good score? Because if we're talking about step 1, as Jose said, this is basically one building block in your application if you would want to go to the US. Arguably, it's the most important part of your application. If you're going to ask people in the US, some program directors, they will usually tell you that if you have a very bad score, there's almost no chance that you're even getting an interview. So from experience, the USMLE Step 1 exam and the score you get is much more important than all other components. But what is actually a good score? So if you look here, we have a table from the first 8 that shows what are the averages and the average scores US seniors, and I would like to highlight that, got while they were applying for different specialties. What you can see here is that it basically differs a bit. You have very competitive specialties such as plastics, in contrast to less competitive specialties such as family medicine. What I want to say here is that if you plan to do plastic surgery, if you plan to do neurosurgery, if you plan to do interventional radiology, you will be expected, especially as an international medical graduate, to have a very competitive score. Of course, those are just averages, and you're not only your score, but there goes much more into your application, such as your personality, such as your Step 2 score, such as your other things in your application. But just know that as long as the Step 1 is going to be numerical, and it's going to be numerical until 22, you will have to score, you're expected to score somehow high in order to be accepted for an interview. If we look here at the minimum passing score, it's going to be around 190. So while you're studying for it, your goal should be never really to just pass the exam, but really score as competitively as possible, and especially as an international medical graduate. And so you see here's the curve, and a good score is going to be anything above 240, probably, if you can say it like that. But the main takeaway is just, as long as this Step 1 is numerical, prepare as good as possible for it. If any, yeah, José?
If I may also add on top of that, guys, again, Step 1 is going to become pass or fail in 2022. But 2 things that you need to remember is, even if you apply after that date, if you took the exam before that date, your numerical score will be on your application displayed. So it can give you an edge, let's put it that way. Whatever we're speaking about will still be very, very relevant for Step 2. So be aware that as Step 2 is going to become more important in the future, you'll still be expected to get those high score. So doing the USMLE Step 1 now kind of gives you a chance to differentiate yourself with 2 exams. And I think the most important component for you to actually realize, and again, we'll talk about that in more depth toward the end, is it's good when you apply to the US to have a good idea of the specialty that you actually want to apply to, because you need to make a game plan when it comes to your score. Because as Chris mentioned, it's difficult for us and anybody to tell you like what a good score is if you don't tell us the specialty you're interested in. If you want to do family medicine and you have a little time, you're struggling with the exam, scoring a 230, 240 in family medicine is going to be a very strong point when you apply, for example. While if you want to do anything in surgery, in plastics, in diagnostic radiology, you want like a minimum of 240. So while in one category, a 230, for example, will really set you apart, in another, a 230 will prevent you from actually even reaching the interview. So just be cognizant of that and include that in your study plans.
I agree with that. Okay, now we can move on. I would just like to show you an example of a test question, how my thinking is when I approach this question. And I think this can be also very useful for first, second year students, just to have an idea that, for example, when you're studying some subjects in your year, how they might ask it, in what way they ask it. And you see, it's not that bad. It's actually going to be a lot of fun when you're looking at that. So the first question that we are looking at is just, as you see, I have 2 questions prepared for it, but if we just read together, there's a 37-year-old woman, right lower extremity edema. She's evaluated for sudden onset of shortness of breath. Okay, that's quite interesting because she's somehow a young woman, middle age, and shortness of breath, pleuritic chest pain. Okay, so now you can already think about stuff, but what they're actually doing here, they already give you the diagnosis. they tell you, okay, she has pulmonary embolism. And then they ask you about pulmonary arterial hypertension and what is the most specific indicator of it. So why did I put the question here? As you will see when I show you the second question, sometimes what they are actually doing is that a lot of the stuff mentioned at the beginning is not very relevant. Sometimes it's enough to just to read the last question, read the answer choices, to have a general idea what they actually want. And sometimes it's even enough directly to go for the answer of that question. So it's much less about what the actual answer is here. Now I just try to show you how such a question looks like. So if we want to go and look at the answer choices now, pulmonary arterial hypertension. Classical scenario for that is pulmonary embolism. So there are multiple small microembolism that can over time lead to secondary pulmonary arterial hypertension. So this is a classical scenario. But what they're asking you is, what is the most specific indicator in physical examination? So it's not only, so you should be also familiar with some physical examination findings. And usually how you go about those questions is oftentimes by mode of exclusion. You will look at the questions, and sometimes you will not directly know what's the correct answer, but you will see what is the most likely answer. And this is how they want you to think. They want you to think, then when they want to make you think some differential diagnosis, things that sound similar but aren't the same. So for example, pulmonary crackles. This is usually a sign when you have left heart failure. The blood goes back to the lungs, and then you go with your stethoscope there, and then you listen there and you hear some crackles. So this is not and if we look at other signs, it's not going to be the most specific sign. Presence of an S3, so it's a third heart sound, is also not the most specific sign of pulmonary arterial hypertension. It's much more specific sign for heart failure. Peripheral edema, increased venous pressure. These are signs that I would expect when you have a patient with right heart failure. So I can already exclude that. And P2 louder than A2, this is going to be, out of those things, the most specific signs of pulmonary arterial hypertension. Again, I just wanted to show you some sort of format, how they ask it. And let me go to the next question. Okay, and let me try to delete that. All right. So I'll give you now some time to read it by yourself. The first and second and third year, don't worry if you don't get it right away, but I will give you now 1 minute to just read it by yourself. And you can write in the chat what you think is the right answer, A, B, C, D, E. So you will have, like in the USMLE, let's say 1.5 minutes to read it, and just put it into the chat. I will read it, and then we can go through it together, if that's okay. José, are you looking at the time?
Yeah, we have like another 30 seconds or so.
Perfect.
I'll give you a wink once the time is over.
And feel free to write it into the chat. It's no problem. I mean, you're not expected to make the right decision. Just make some educated guess what you think could be right. I think it's a hard question. Okay, interesting. Any other opinions? Many people say A. All right, so let's go through together. All right, let me just figure that out. All right. As we go through the question, I have marked some relevant parts and I will talk about it in a second. So A was correct. Usually the way how I go about every question is that I first read the question, because they can give you a whole patient scenario and then at the end they ask you about some genetic mutation, which is totally irrelevant to the whole scenario that is written there. So the question asks, what additional findings are we most likely to expect in a patient presented with that case history? Okay, let's have a look at that. So we have a 45-year-old man. Wait, let me just see. That comes to the hospital with 6-month history of progressive weakness. He has dysphagia, dysphagia. He has lost some weight during that period. Okay, at that moment, I would probably, because I take clinical oncology exam, I would think about cancer, because I would think about, okay, maybe some esophageal cancer, weight loss. There's always some signs for cancer. Then I will continue. Okay, now it's really weird. Then during the 3 weeks, the patient was put into the wheelchair. Okay, 45-year-old man suddenly in a wheelchair with progressive weakness. Okay, then they will tell us he has no other history, no other major medical illness, takes no medication. He's a former financial analyst. Okay, that's not really a risk group. They even mention that he has no toxin exposure. So he's very, just like a normal dude. And he suddenly develops some very severe symptoms. He doesn't smoke, he doesn't drink alcohol, so we can automatically already, he has no risk factors. I wouldn't think about cancer at this moment. He's 6 feet tall. Okay, he's a bit thin, but that could be probably related to the dysphagia and the 6 month of weakness. That could be likely the cause. He has normal temperature, so no infection. He has normal vital signs. Respiratory rate is normal, pulse is normal, blood pressure is normal. He's mentally alert. Okay, but what they say here now is that is muscle fasciculation of the upper extremities and weakness of the lower extremities. So what you should be thinking about now at this point is probably ALS, amyotrophic lateral sclerosis. These patients present typically as those patients as we have here, typically male, around 50, 60 years old, and suddenly they will develop severe symptoms, upper motor neuron, lower motor neuron symptoms, what we can see here in this patient. So this is a classical scenario for ALS, and those people who took A, that was correct. But how I would go about it now, when I think about ALS, I will look at the answer choices and you would exclude certain things. So ptosis, okay, this is not a classical sign for ALS. This is, you would expect maybe something like that in Horner syndrome. So I would take that out. Palmomental reflex, to be honest, I have no clue what it is. So I will probably take that out. If you know it, you can put it into the comments. Loss of proprioception is quite interesting because is it going to be a sensory sign? And sensory signs are usually absent in ALS. So we can take that out. And decreased visual acuity, we can take that out too. So the most specific sign for ALS is probably atrophy. The patient also has fasciculation, which is also a typical lower motor neuron sign. He has weakness, is also classical lower motor neuron sign. What I want to say here is that nobody wants to trick you in this exam. They just want to know you, they just want to see if you can apply that knowledge that you have. So it's not enough to know that this patient has ALS. You also have to know what are the signs and symptoms that are associated with a patient that likely has ALS, and put it into contrast to other symptoms of other neurological diseases, and which could also happen in such a patient, but which you have to exclude, basically. All right.
So,
José?
guys, if I may add on to what Chris has been talking about. So the first thing about the USMLE is it is definitely not a pure recall exam at all. It's an application exam. So in short, you're trying to take the knowledge from like your preclinical years and you apply it to a problem. It's going to rarely be something where it's asking a question and then you're just answering a fact. It's often a 2 or even a 3-step question. So they will give you some symptom, for example, in the question, like in this case, and they're not asking what the diagnosis is. They're asking you what will be, let's say, an extra finding. So you have to work at it in multiple steps. You have to say, okay, those were the symptoms. So the most likely possibility for the disease, in this case, would be ALS, for example. And then you ask yourself, okay, what would actually be shown in that patient afterward? In this case, we have the atrophy question. It's always those multiple step questions. They might give you symptoms, and then they will ask you what the treatment is. So it's your job to actually figure out what the disease is and then figure out the medication. Sometimes they might even ask you what will be the mode of action of the medication that I will give for the disease. So in this case, it's 3 steps. So I think the most important thing to take out from like what Chris has been doing is, one, always reading the question very carefully, because the words are actually always going to point to you in a certain direction. And you should always try in certain questions like the one we have here to build something called like chronological pathophysiology or chronological physiology. So as you read the symptom in your head, try to build what the symptoms can lead up to. Or if you have a disease, like the last question when we're looking at like the pulmonary embolism, walk through the individual step of what you would expect to happen following, let's say, chronic emboli. And from there, you can actually easily pick the right answer. I think that that's definitely the best approach, because, you know, if you pick the right answer for the wrong reason, sure, you got a question right, and on the day it's great. But in terms of your long-term studying, that's actually very detrimental to your score, because you want to follow the same approach systematically for pretty much all of the questions. And when you're picking your answer, you have to make sure that you have a good pathophysiological reasoning for why you pick it. And also understand and know why the other answers are either wrong because they won't fit that chronology, or unlikely, like Chris actually talked about, saying those are possible, but it's unlikely. So it's really important for you guys to do that constantly for each question. And that's probably one of the ways in which you're going to really improve your score when we're looking at question interpretation, because the exam is knowledge-based, sure, but as we'll discuss in a little bit, question interpretation, especially if you're aiming for those higher score, is probably the most important part.
Yeah, because also in the real exam, there are always a couple of questions where also have no clue what's going on. And sometimes it's really also just by exclusion of what is the most likely. They really know that you can't know everything, but they also want you to see if you're able to use what you know and somehow apply it and choose the most likely diagnosis or most likely answer, even though you don't know it. So that's also a skill. Let's move on. So if you go onto the internet, Reddit, and you ask, so what are the best resources for step 1? Most people will always talk about the UFAP method. And José and I, we want to talk now. Is that really true? Should we use it? What did we use? What were our thoughts after taking the exam? And just to look at it a bit more critically. So is the mantra UFAP, is it true? So I've built it like that. So I hope José agrees, but I think yes, partially. We'll get to it in a second. So QBank. QBank is certainly one of the most important resources that you will use. QBank is short for question bank. And as you saw, the exam is question-based. So the more questions you do, the better you will do on the exam. So you will need a question bank to prepare you for the exam. I swear 100% on UWorld. I almost didn't use any other question bank at all. José, what do you think?
So I definitely agree with you when you're saying that like the UFAP method is like partially correct. And when we're looking at the QBank and when to do QBank, you have a different approach also depending on where you're at. Personally, if you have the time, because that's also very important to take into account, how much time do you realistically have to prepare? So if you only have the time to do one QBank, I will agree with Chris in terms of the quality of UWorld. It's probably the best QBank out there. I, throughout 4th year, actually managed to finish the Kaplan QBank prior to my dedicated study. and then I went into UWorld. And I think that doing question on daily basis, even if it's 5 questions, and sure, you didn't study yet, so you're gonna get a low percentage. It's just gonna, one, build up your question interpretation skills. And second of all, it's gonna help you review some random facts throughout the year, throughout the day. So I would probably suggest doing both QBank if you have the time.
Yeah. So yeah, so there are basically 2 branches to look at it. There's one QBank. Everybody has to use QBank. This is a very important resource. I don't know anybody who has a good Step 1 exam and did it without a QBank. And on the other hand, there's basically a second branch, learning material, because you cannot just go into the question not knowing anything at all and then just trying to answer those very hard questions. And so what are the learning materials that we used throughout the years, in the last year and in the last 2 years, to study for individual topics? I think, José, we can agree that Pathoma is hands down, at least in my opinion, the best resource for pathology, pathophysiology, in a way that is just very high yield. Everything that's mentioned there is very important, and the way how Hussein Sattar, who's the author of Pathoma, describes it is very great.
Definitely, like Pathoma, like when you all do your QBank after finishing Pathoma, for most of the pathologies, either you'll get it correct using Pathoma, or it was somewhere in Pathoma. It's very rare that the specific pathology is not covered. So by doing Pathoma, you're going to get very good, concise material covering, let's say, nearly all of the high yield, nearly all of the middle yield, and most of even some of the low yields. So Pathoma definitely go to for Patho and Pathophys.
Yeah, exactly. So next one, Sketchy. I also say Sketchy. This is the only thing that I used actually for pharmacology, microbiology. I think all the little pieces of information in Sketchy are very high yield, and they are they are very high yield. I personally never looked at any of the pharmacology or microbiology in the first aid at all. So I just use Sketchy, and anything else, any additional information, I would usually just learn by doing the questions. If that makes sense.
Definitely, that's also what I followed, and I think you'll see it later when we'll show you the QBank. Of course, there's always a score at the end, but there's also like a QBank, which will really show you also your knowledge in the category. And by just using those resources, Chris and I in micro and farm, for example, we did extremely well. So Sketchy really go-to material for the learning and also for actually remembering the information, which is extremely important for the exam.
Exactly. So I have a third category because miscellaneous. So it's basically all the other stuff. Because, you know, pathology constitute the biggest part, pharmacology, microbiology. So you almost have like 70%. The rest of the 30% are going to be some important details out of biochemistry, physiology, anatomy, histology. So, well, how I would say, when I was in second year, I just used the material like Lippincott or other university material or Costanzo for physiology, and it was really good to learn the material for the first time. Unfortunately, after 2 years preparing for the USMLE Step 1, I just noticed that, especially in biochemistry, I had no clue what is going on because I forgot everything about it. So I needed to review it in a very fast fashion, in a fashion that let me focus on the most important details of biochemistry, which are going to be some clinical aspects in the USMLE Step 1. So what I did is, and I really fell in love with it, is Boards and Beyonds. This is a resource made by Jason Ryan, which is a cardiologist at Harvard. He made, in a Pathoma-like fashion, also videos for every subject, and he basically just talked through it based on PowerPoint slides, but in a way how they actually ask it on the exam. So what I did is I used Boards and Beyonds to review biochemistry. I didn't have to review much of physiology, to be honest, because I did physiology as a teaching assistant for 2 years, did the same for anatomy and histology, so I didn't have to review so much of it, but I did use it a lot for ethics, psychiatry, and also to review some bits of immunology. And if you put it to some concrete pyramid, make it more comprehensible, UWorld or any question bank for that matter, just have questions in your repertoire, and Pathoma, Sketchy, And the more you go towards the pyramid, the less important the resources are going to be. So here we have Boards and Beyonds, but I would tend to almost put it here, and some other resources.
Yeah, no, to add on to what Chris has been saying is there are a lot of resources out there. So it's actually your job in a way to decide what works for you. The two important things to always keep in mind is you don't want to, let's say, use 2 or 3 different resources to cover the same material, because that's going to be a waste of time. If I have 15 hours, let's say, like just as an example, and I know that Kaplan for pharma is, let's say, 5 hours, Sketchy for pharma is not 5 hours, but let's just say it was 5 hours. It's 5 hours, and then I have a book and I can cover it in 5 hours. It's better to pick one of those resources and really master the material, understand the material from one of those resources, instead of just cramming each individual one and ending up with a weaker knowledge base. The second thing about the pyramid that Chris has like beautifully drawn, I mean, it's a work of art. If medicine doesn't work out, Chris, I think you can go into like pretty much the artist world. That you're gonna do Marvel. But the point, guys, and we'll talk about that again a little bit more details when it comes to planning, but that pyramid is also very individual. When you start studying, and we'll talk about when to start studying and how you start studying for it, it's very important to have a baseline, because depending on where your knowledge is at the start, you're going to want to do things very differently. Let me give you an example. If you were to take your first diagnostic or NBME and score, let's say, like below a pass, which is fine at the beginning of your preparation, you have to acknowledge, say, okay, this is what I got. I'm quite weak in those topics. So you really have to work on the actual knowledge. So in this case, maybe you definitely want to cover the full pathoma. In this case, you want to go to resources like Kaplan that really builds the knowledge from the foundation up. And you really want to target those topics you read. Like, for example, in biochem, Chris and I, we both did pretty much the whole Kaplan biochem. And then for revision, sure, we use Boards and Beyond. But because that knowledge was quite weak in that category, you have to spend time on learning it from the base and really mastering the concept. So really be aware of that. And we'll talk about like the intricacy of your planning in a few slides.
All right. So there's one big question that maybe some of you have been asking is, what about first aid? Because first aid is one of the UFABs. Everybody recommends it, but I want to look at it a bit more critical. In a way that, okay, as José has said multiple times, and as I've shown you, USMLE is a test of application. So you have to not only memorize just a list of things, but you also have to know how to apply them. If you look at the first aid, again, it's a great book. What you end up having in most times, you just have a list of findings that you will have in the patient, and it's just based heavily on memorization. So what I want to say is, it may be great for review to look at it once you studied the material, but not to study it from scratch. Just think of it. If you go in the second year to a biochemistry exam, you cannot just open the first aid and start to study it, because you don't have any context where to put all those information. You need to have some groundwork, some foundation where you can build up. But once you have that, maybe the first aid could be great. I personally didn't use it as a textbook per se, but ended up using much more of the other resources, such as Boards and Beyond, also AMBOSS for certain topics, Sketchy, etc. So for example, in pharmacology, microbiology, as I said, or pathology even, I didn't even look at the step 1 parts of it, because I felt it was just a list of things that you can memorize, and all the details that might be not in the first aid, I would have usually studied while doing the question bank, while training for the exam. But what do you think, José?
So this book is complete garbage. No, I'm kidding. It is still like a recommended resources, but definitely I think there's a lot of misconception about its usage out there. Because the point is, as Chris really mentioned, USMLE is all about application and about having strong bases, strong thinking process, and integration of information. The first aid doesn't have any of that in it. It's a book where you might have hypopituitarism, and you're just going to see a bunch of arrow up and down for the different hormones. If you are memorizing it, and some Reddit suggests that, yeah, just read first aid 3 times and you're gonna ace the USMLE. It's one, bullshit in most cases, and two, it also depends where the person that started studying was. If the guy was already starting with his first NBME with a 250, yeah, sure. The only thing he needs to do is make sure that he knows, let's say, the little details that are in first aid and do question bank. But for nearly everybody, and for most people that also score well on the USMLE, you have to build up those foundations. So if you want to cover the whole of first aid, honestly, boards and beyond, cover first aid, but actually explains
what's
the
inside
details of first aid. The only way, I think, to use first aid in an efficient manner is not to memorize it, but maybe to keep it on the side. So when you're studying, you can look into first aid and just use it as a checklist, because that's what first aid actually is. It is not really like a study resources on its own. It's a checklist telling you, okay, in cardiology, those are the facts that you should know. You're like, okay, I know this, I know this, I know this. Okay, I don't know this, I'm going to circle it. I don't know this, I circle it. You close first aid, you put it on the side, and then you use your resources to master the topics that you either forgot, that you don't remember, and you refresh anything that you don't know.
I would also like to add, just as a final thought for that, an example. For example, I was in 4th year, I had my 1-week course of immunology. So, or was it 2 weeks? I don't remember. But what I wanted to do is, okay, I knew I was going to take the step 1 in the end of the year. So I thought, okay, I already bought the first aid, and I will look at the immunology. I will study the whole immunology in first aid, but it's not that much, like 15, 20 pages. And then I will study for the exam. But there was like one table of like all the HLA types, like DR2, DR3, DR4, for all the diseases. So, you know, DR4, rheumatoid arthritis, Addison disease, B8, A3, or something like that. I don't remember. So what I ended up doing is actually, I ended up studying the whole table of all the HLAs. And now, after taking the exam, it was completely a waste of time, because nobody asked me about the HLAs. They might mention it in the big text of presenting you a patient with rheumatoid arthritis, that he might have some, they did some testing and found out the DR4, but then they ask you about some medication. Yes, maybe it was mentioned, but you don't need to know every little detail in first aid. If that makes sense, if you look at it in that way. Okay, but let's move on so we can talk about other things more. There was one question, Anki, yes. There was one question I saw in the chat was if you used Anki. I wanted to make intentionally one slide just for Anki, because Anki is a way how we studied, how I studied, but it was not it's not some sort of book to use. So for those who are not familiar with Anki, it's a flashcard system, an electronic flashcard system, where you can have the front page a question and the back page you have an answer. It builds on the principle of spaced repetition. Back then, last year, José and I, together with other people, we did an event for 3rd years, how to use Anki, how to study for pathology. I did it also twice for first year students, and we basically showed them how to use it. So it's basically a whole science for itself. And it's a way how we study and how you retain all that information. It is true that USMLE Step 1 is a test of application. On the other hand, Anki helps you a lot to keep those bits and pieces of information in your head. So there are 2 ways how to go about it. You can make your own flashcards, this is great, or you can use somebody else's. I can just talk from my personal experience that in 3rd year, I was using Pathoma like a madman. And I was making questions for every fact in Pathoma, and it was just starting out with flashcards. I was just experimenting, and it really helped me a lot to really get this material into my head. But I didn't really use Anki or any other flashcard program throughout the summer for like the 3 months, because I did other stuff. And then I didn't end up reviewing it. And when I looked at my own pre-made flashcards, they were a bit, they were way too big. I didn't really phrase it in the right way, so I can understand it after half a year. So what I ended up doing is I just used some pre-made flashcards, and the most popular on the market is Anki. So what is Anki? Anki is basically pre-made flashcards from a guy from Reddit, Anki. He made 26,000 flashcards regarding all the subjects that are going to be asked on the step one, except with the exception of pharmacology and microbiology. And what I end up doing is I basically took those questions, and for example, I would go to cardiovascular system, and as I was reviewing cardiovascular system, I would basically just spend like half of the questions, because you will see that in Anki specifically, half of those questions are very low yield. They're asking you very basic stuff that you would know by yourself anyway. So what I end up doing is I had like 10,000 cards of Anki that I did throughout my whole fourth year. I used Pepper for pharmacology and microbiology just to reinforce the fact of sketchy, because Pepper is another sort of pre-made flashcard deck that basically took all the sketchy micro videos and made questions out of it. So it was just a way how to digest all those information presented in sketchy. If you're good doing your own flashcards, then I highly suggest you do your own flashcards and use them. But for me, my specific situation, I use Anki. Many people only use Anki, and this is what I ended up doing.
To build up on what Chris was talking about, because I also used Anki heavily, but actually quite different decks compared to what Chris used. But I also used in the same fashion as Chris, like the Pepper deck for like the farm and the micro. I used the Duke's deck, which covers pretty much Patoma, light years for the boards and beyond, and the USMLE. So guys, two things. First of all, at the end of the presentation, because I see a few of the questions, we have the links to like all of those resources we're talking about, including Anki, which is a resource that will actually teach you how to use Anki, as well as med school, like Anki.com. It's a link at the end, where they have all of those decks for free, so you don't even have to Google them, and you can just download it straight away from there. But I think that what Chris did is definitely the smart thing to do, and it's also something that I did, is you definitely don't need those 27,000 flashcards. Like, it's absolutely insane, even across a year, even across your whole med school, to be honest, to have this many flashcards to do. Like 4 years US, I mean, not like us 6 years. But you need to understand that simply memorizing like the Anki facts, let's say, or the light years fact is not going to get you very far. What you want to do is make sure that you are making flashcards and studying the flashcards on things that you're not familiar with, that you don't remember well, like pathology. And the second thing that you want to do as you're doing your QBank is creating your own flashcards. And even when you're trying to master concept, creating your own flashcards. And if you guys want to actually see how to do that, I suggest that you go on the USMLE website. They have tutoring, but they also have their own like flashcards deck, which is like only, I think, like 2,500 flashcards for step 1 and pharmacology together. And I think that those are the perfect example of what good flashcards should be. Good flashcards should be higher material, where you have an actual pathophysiological chronology to explore like difficult concept like heart failure, where you have some memorization based flashcards like, okay, this is drug A, this is the mode of action. And this is really what you should be spending your time doing. Simply making a flashcard about a question wrong, saying, okay, symptom A, B, C, D, and then on the back of your flashcard, you say ALS, that's not really a good flashcards to do. One, you already have flashcards like that are made. And second of all, when you're making your own flashcards, you really want to build up a story to make sure that you actually understand and apply the concept. It's really not about like, okay, how do I score high on step 1 or step 2? I'm going to do 100,000 flashcards. That's definitely not going to take you anywhere.
Yeah. Okay.
You need high yield material, very well presented.
I agree. And just to wrap it up, I mean, if people are interested, we can make an event, again, an online event. I mean, we already did the presentation, so just let us know. But just to wrap it up, I know there are many people and I don't want to confuse them. So just to put it into perspective, again, I just want to repeat it. We are talking about the resources, about what we recommended, and Anki was basically just a way how to study. We have links at the end for you to look at if you want to go into greater depth. So let's continue. So this is a meme. I don't know if you can see it. So what it basically says is just if you should do your flashcards on a daily basis, because otherwise you end up happening that you have to review such a big chunk of flashcards and you don't want that. So what actually determines your score? So let's look at the USMLE Step 1, and there was actually research done on it. They were looking at US students and what they did and tried to basically create some predictive model for the USMLE Step 1. And what they basically found out for US students was that the score correlated positively with the questions that they did and the grades that they received during medical school. So what does it mean for us and what can we extrapolate from that information? So my personal interpretation from that when I read it first is that the way how you prepare for the exam should be prioritizing questions. We already said that Q-Banks is the most important, but we cannot stress it enough that once you study for the exam, especially in the last 2 months, your so-called dedicated period, you should prioritize your question banks over reading. So don't just read the first 8 and spend the majority of your time with it, but really do those questions to be really learning the material. Not only will you repeat the knowledge that you know, but you will also learn new material or reinforce the material. What I also want to say is that many people think that when they ask you, how long did you prepare for the USMLE Step 1 exam? And they ask, and then I'll say to them, yeah, my dedicated period was 8 weeks. But to be honest, you cannot just say I prepared only 8 weeks for the USMLE Step 1 exam. You cannot finish all the material in just 8 weeks. You need to know something at the beginning. Actually, you need to have studied all the material or most of the material already before you go into the dedicated period. So what I want to say here is that you should prepare well for your course exam and incorporate USMLE Step 1 material early on. So what does it mean in practical terms? Somebody who's preparing very well for his pathology exam, who's taking another 2-3 weeks to prepare for his pathophysiology exam, he will not need as much time to review later on when he's doing the Step 1 exam, all the material, than somebody who just studied half of the questions, go to the exam and still passes somehow. I mean, this is somehow, we all know that, but I just wanted to reinforce that. And incorporating USMLE Step 1 material early on does make sense. Why does it make sense? Because, for example, in pathology, I was using Pathoma heavily. I already had those high yield material in my head that when I was studying in the last month for the USMLE Step 1, after 1 year, I already was very familiar with the pathology facts because I studied it so well from Pathoma the year before. And just to build up on that fact is, José and I, we are both physiology teaching assistants. I think we both didn't have to review anything of the physiology because we had weekly courses with our students and we were teaching them physiology facts. So it doesn't make sense to get involved as a TA. It's questionable if it really pays off to do anatomy and histology just for the sake of scoring well on a Step 1. I definitely don't think so, because anatomy and histology constitute maybe 5% of the exam and you will spend a lot of time. But in case of physiology, personally, I found it to be very helpful and I didn't have to review any of the physiology when I studied for the Step 1. And yeah, José, do you have anything to add to that?
I mean, like what you're saying, like it might sound very intuitive, but a lot of people like don't understand the facts that like Chris just mentioned. And I know I always say we'll talk about it in a little bit, but we're getting to the schedule, so we'll talk about this in more depth. But really, when you're actually preparing to take your USMLE exam, like a big determinant of your score is like your first NBME. And what determines that score is how well you know the material beforehand. Like your pre-dedicated time, so the time before you're even focusing on studying for the USMLE, is actually more important in many aspects than your dedicated study time, because how strong the foundation that you have are once you start studying, it's going to really help you in the end, and it's also going to shape how you're going to study for the exam.
Agree. Okay. Yeah. Anything else, José? Or I can.
No, I think we're gonna go through like your report and then mine, like share our like.
And then we will have
study
a
schedule and have questions
on the end for you to have questions. You can feel free. I already saw there were some questions in the chat, and I will talk about it individually in the Q&A. What José already said is, if you look now at my report, it doesn't make sense just to do the things or just to orientate 100% and just do what I did in the dedicated period, because you have to look also what I did the years before. I 100% believe that none of us are extremely smart more than you. I don't think so. I think anybody can score very, very well if you know the right systems and if you just follow the right systems. But it is such a big material. You have to start early on, you have to do the right things. And my hope is that really once we go through the material there, that you might take bits and pieces for yourself and avoid certain things, do certain things to really get a good score. All right, so let's start with the pre-dedicated period. So I started very much at the basic, my first year. When I recommend first year students to do now is don't worry about the USMLE, just focus on surviving. It's a hard year, it's your first year. Don't think about the USMLE. You can think about it in the summer by just researching and looking at our presentation again, looking how all those things work. But when you're in first year, don't focus on it. And so what I ended up doing, I was just studying the course material. In the summer, I was just relaxing. And in my second year, I was the TA in histology and anatomy again. This was very helpful. I didn't have to review much of histology and anatomy for the step one. On the other hand, it's only 5% of the exam, so you don't have to do it. I think you can just study it in a few days before the exam. You can study it as you do the Q-bank. For biochemistry, I used Lippincott. I used for physiology, Costanzo and Guyton. So my primary objective for physiology was to become a TA. So I also used some more deeper reading materials such as Guyton. This is definitely not necessary to passing the exam or definitely not necessary for the step one. Costanzo is a great resource to build a foundation for physiology, as is Lippincott, but it's very low yield. So looking at it again, maybe I would have used Kaplan if I really wanted to already start in the second year, but I don't think it was such a big mistake because I think I did the boards and beyond review in my fourth year. I didn't remember any of the biochemistry, or I thought that, and I got most of the biochemistry, if not all, correct. So there was no problem. Next point. Okay, now in the third year, it's going to be more interesting because in the third year, you're actually going to cover 70% of the material, pathophysiology, microbiology. And well, as I said multiple times here, I use Pathoma as my primary go-to resource. I made my own flashcard, as I said, so it's just repetition. And for Sketchy, and for microbiology, I used Sketchy videos. I added some ambos to fill out the blanks for the final questions. And I used Pepper and made partially my own flashcards to reinforce that material. So my summer was off, and I did start pharmacology 2 weeks before fourth year because I was working back then in a cardiovascular clinic. So I wanted to at least start with cardiovascular pharmacology and extracurricular activity. Again, the best thing that I could do was doing the physiology teaching assistant. That helped me really to reinforce the material. It's definitely not a must, but just to tell you what I did in my third year. So now it's going to be interesting because this was now 1 year before the step one exam, 1 to 2 years. In my fourth year, this was basically the entire fourth year before my dedicated period. So what we had pharmacology, a big exam in February. I did use Sketchy for it. I used Pepper to reinforce all the material, and I continued doing it also in summer semester after I finished my pharmacology exam, because I knew I was going to take the step 1 at the end of 4th year and I needed that knowledge. Microbiology was luckily repeated due to infectious diseases. And I also did just review the flashcards from Pepper that reinforced the material from Sketchy in February. And now this is an important piece of information, is that at least in LF1 and LF2, what you will not have covered for the step 1, these are going to be the only exceptions, but it's not such a big problem. It's going to be psychiatry. Biostatistics is partially covered because you have hygiene and epidemiology, but what you will not have covered is behavioral science, even though we have ethics, but it's very terrible here. And so what I ended up doing in my February, when I had free time, I studied psychiatry from boards and beyonds. Didn't take much time, maybe 2-3 days. It was very high yield. I did biostatistics, and I believe I also started to review biochemistry, because I knew biochemistry is my weakest subject, because it's very memorization heavy, and I know I don't want to go into my dedicated period and having to review biochemistry. So I did that in February. In my free time throughout the winter semester, and more pronounced during the summer semester, I worked with Anki and some of the flashcards that I made myself. Again, I suspended probably half of Anki's cards because of the previous knowledge. I knew pathology very well because I studied well for the pathology exam. A lot of Anki and other pre-med decks is very low yield. So I happily suspended half or 2/3 of Anki. And what I also did was Kaplan QBank. I actually bought the Kaplan QBank, and I did around 500 questions just by doing daily questions. I think that the way how I used the Kaplan QBank was not very good. I don't think it contributed much towards my score. I think it showed me how they asked the question, but I did it in such a disorganized way that it was probably not that helpful for me personally. I will say more about it later. But what I did in March, I took the exam at end of September. I did a self-assessment test. I got like 65%. I believe it was a very decent score. And what Kaplan also came to us in I think in the winter semester, and it told us that if you get more than 50 or 60%, you can study for the exam 3 months. You should be fine to get a 240 score. I think this is what they said. So what it basically says is that I already had a lot of the material inside my head as I was already in March. So just to give you some sort of idea. And so now, interestingly, now to my dedicated period. Of course, the pre-dedicated period is very important because it builds your foundation. Ideally, before the dedicated period, you want to have studied at least once all the material that is required for you in the exam. You don't have to know everything 100% because you will learn a lot during your dedicated period. You will review a lot, but you should have a strong foundation. So I took, I would generally recommend 6 to 8 weeks, and I took 8 weeks for my preparation, and I had the test date at the end of September. So I set a date, and then I studied towards it, and I told myself that I have to be finished at that point. So how did my schedule look like? Okay, I told you that I did like 500 questions in Kaplan. I don't know if that, of course it counts, but I wish I would have done Kaplan as José in much more organized way and really do more questions throughout the year. I will talk about it later, or even start earlier with UWorld. But 8 weeks before the exam, I bought 3 months of UWorld, and I had basically 3,000 questions in the UWorld question bank left. So I didn't do any UWorld question before the dedicated period. And what I wanted to focus on are 3 things. I wanted to finish the UWorld question bank. I wanted to keep reviewing the old material via Anki. And I wanted to do the practice exams to see if I will meet my goal, because my goal was like arbitrarily around 260. And so my daily schedule looked like that for most of the days. I would wake up at 6 or 5:30, mostly at 6. I would take my time. I always had my morning routine with my coffee, with my breakfast, with watching the news, answering emails, etc. Then I would do 2 blocks of UWorld, and then I would review for the rest of the day the UWorld blocks. Block 1, block 2. I would have a lunch break. And of course, there were also some small breaks in between those things just to rejuvenate myself. Around 3 or 4, I did Anki because I finished UWorld review. And then at the end, that was basically most of my day. So let's have a look at that. I made some Google document. For those interested, I already wrote the whole score report in our Charles University USMLE preparation, so you can have a look at that. It's much more in depth. But what it shows here, I put in morning blocks, afternoon blocks for each day. Sunday was always my off day. So what I did on Sundays was I just did my Anki, which would take maximum 1.5 hours. And then the rest of the day, I would go out with my girlfriend, would just chill, go to the gym, just really relax, because I think even in the dedicated period, it's so important to have one day to really rejuvenate, because otherwise you will totally burn out. And on the other days, I did UWorld blocks in the morning, 80. I would review each UWorld block, and in the evening, I would just do my Anki. So here you can see my progress overall. I really started very high, around 70. Around 80% already at the beginning of my dedicated period. And what else is there to say? And yeah, that's it. So do's and don'ts for the dedicated period. If I look now again at it, it's the most important thing, I believe, in the dedicated period is to review the question bank, review your questions, each block that you do, as good as possible. So when you go to UWorld, you will usually do 40 questions in a timed and random fashion. What it means is basically that you have 40 questions out of all the subjects, and it's going to be timed, that they give you only 1 hour for all the 40 questions, and you have to be finished at that point. After that, you will get your score. It's going to be like 70, 80%, or any percentage for that matter. And then I would, after every block, I would take my time to review that exact block. I would read every single answer choice individually. I would spend at the beginning 2.5 hours per block. At the end, it was more like 2 hours. So I would really make it a time-intensive matter doing the question bank. And I think this is the most important thing that you can do. And you will see it in my NBME scores. And exactly, take 1 day off, that's what I said. And what I also want to say is that every Friday or every second Friday, I would do an NBME. What are NBMEs? NBMEs are those practice exams that are basically out to the public by the guys who made the USMLE Step 1. They are the most predictive things that you will get for the real exams. Because if you do the NBMEs and it shows you that you get a 200, you cannot expect to go to the exam 1 week later to get a 240. I will talk about it in a second. So this is my UWorld score. I've basically finished all the questions in UWorld. The 80 questions were added once I finished the step 1. I had an overall of 84%, and this correlates to a 92 percentile, and I only did 1 go through UWorld. As you know, 92 percentile is pretty high. Not everybody will start with 92 percentiles. Some of you will start out way lower, and that is totally fine. But it just shows you where you're at, to be honest. And this is my overall trajectory over the 2 months. So I started like somewhere here, where I did some questions here. I started like around 70, ended up being around 90 towards the end. And now predicting your score. again, NBMEs, I started with my first NBME the first day I started my dedicated period, and I did a 230. This is a very good score for the beginning. You can imagine, you can probably add 30 points in 6 to 8 weeks to your NBME score, I think. After that, I did in 2 weeks intensively all the UWorld questions, 80 questions a day. And after 2 weeks, I got like 260 score, which is absolutely great. But the UWorld self-assessment tend to over-predict your score by around 10 to 20. So you have to be very, very careful with that. But nevertheless, it's a great exam. It's a great experience because those exams usually last 4 to 5 hours. And just shows you how it feels to go to the exam. My following NBMEs after 2 weeks was a 250. It's a great score. After 1 week, I did the next one, a 247. So there's a decline, and I wondered why. So I did 2 more weeks of studying, and I got a 255. So at that point, I knew, okay, I can safely go to the exam. Now it's really just to finish strong. My second UWorld self-assessment was around 266. And the NBME 120 was a 93 percentile, which correlates with that score. So what you want to see basically in the dedicated period, first of all, you want to do at least some NBMEs. They're not there for you to study the material and for you to learn new material. And most likely, and they will just show you your score and they're very predictive. They're the most predictive things that you can get. And on the real deal, you will probably end up scoring something between your NBMEs and between your UWorld self-assessments. This is my personal opinion. And so if I would start with a 190, I know that I will not be finished after 2 months at my goal. And I know that I would have to probably extend it by another 2 months of studying, just as an example. And this was the final score. I scored a 259. I was very happy with that. I even catch coronavirus just 2.5 weeks before. I wasn't so sick, but the whole time during my preparation, I had one objective: to not get coronavirus. But at the end, I somehow catch coronavirus, and I don't know why, because I was really careful. The only thing I did wrong was probably going to the gym, but never mind, everything still went well. I was just knocked out for a few days, but I still ended up scoring what I wanted. I was very happy about that. 260 is the 5th percentile, and so I was really happy about that. Maybe before we go to José, I just want to say something about how the real exam was. As we said in the beginning, it was an 8-hour-long exam. I did it in Prague. And you can read my test report on the Facebook group again. It started around 8, and when you get there, you will see it's very professional. It's very nice. They will check you from head to toe, and you have to bring your passport. You have to bring all your documents, and all the time when you go out from the testing room, you have to sign yourself out and you have to sign yourself in. And the exam itself was basically what I expected. It was really similar to UWorld, but I think a little bit easier in terms of the questions. That's all I can say. So we can move on to José.
Hello guys, so I'm gonna be a bit more superficial because Chris already went in quite like a depth when it comes to schedule. But I want to really start by saying that you should absolutely not follow either Chris's or my schedule unless you already have some kind of baseline. Because depending on where because we all start somewhere different. Depending on where you start, the amount of time that you should spend, let's say, learning versus doing question is going to be very, very different for you to actually go from a score A to a score B. Like to give you an idea, actually, before my study time, which started like this February, in August, I took the Kaplan self-assessment, and I ended up scoring 45% on it. So that gives you an idea, saying, okay, 45%, that's a bit low. There's a lot of like weaknesses in different subjects. So I already know before my 4th year start that there was going to be a lot of like review needed. went through like the winter semester of the fourth year, did the pharmacology using Sketchy again. And from February till July, that was, let's say, my pre-dedicated. So just like going through the semester and starting to actually really study for the USMLE. And next slide.
Sorry.
Yeah, great. So the plan that I did in my pre-dedicated was pretty much doing like a block a day or half a block a day from March. And by doing that, it really helped me to actually like practice the different questions. And the point is, since you're not even your dedicated time, it's perfectly fine to score quite low in your QBank, especially like in the Kaplan QBank, if you use it to learn. I started my Kaplan QBank with 49%. I did NBME, you'll see it later on, but in February actually, and I scored 209 on that NBME. So again, what that NBME showed me, it was like, okay, you have improved from the last August, but it's showing me that I have to spend a significant amount of time in my semester reinforcing a lot of the subjects. Like I also used Patoma, like Chris did, like many people did in the third year, but unfortunately I didn't remember it as well as I wish I did. I also forgot most of biochem, like Chris, like that was a complete like mind blank before like the pre-dedicated study period. And you really need to acknowledge that when you're starting with your schedule, because you can read a lot of Reddits, a lot of research out there. And I recommend you guys to check USMLE at the end of the presentation for like free articles. But the difference between a fail, like a low score on your first NBME, like 190, a 200, a 210, all of those scores, it's showing you that you have a lot of gaps in your knowledge. I had a lot of gaps in my knowledge. A lot of you will have a lot of gaps in the knowledge. It's perfectly fine to have a lot of gaps in your knowledge, but you need to be aware of it. You need to be aware there's a problem, and you need to fix that problem. Because up to the 230 mark from like a lot of the research, all of that is actually knowledge. That's knowledge. It's your knowledge is problematic usually if it's below that. Not problematic in a way that it's bad. It just needs to be reinforced in some topic. And afterward, like when you're trying to score higher than the 230, at that point, it's more about question interpretation. Like it's really surprising. You can see even excellent students from our faculties or even from the US, Yale, Harvard and other places, they might be stuck actually at like a 210, a 220 and a 230. And especially at that 230 margin, it's really about working on your question interpretation and really focusing on doing the UWorld question, on understanding how to answer the question, on building a systematic approach to the question.
Yeah.
So when you look at effectively, like again, like the schedule, this is how it looked like. And the thing that's really important, especially in your in the beginning of your dedicated study time, people, you need to have a game plan in mind. And that still applies to step 2, by the way, for those that are going to take step 1 when it becomes pass or fail. You need to have an idea of the specialty you want to go into. That's, again, my personal opinion, but a lot of people will agree with that. And you need to make a plan targeting that score in a realistic manner again. If you start your dedicated time, like your actual dedicated time with 200, 210, that's fine. But you need to acknowledge that within like 8 weeks, it's going to be very difficult to go from, let's say, 200 to 260. That's not realistic. So you have to be realistic in your approach. And in my case, talking with like my mentor, doing my research, I knew that, okay, I need a minimum of 240 for me to even have an interview. If I'm below 240, I'm dead. Like the specialties I want to do in the US, I will not match for sure. No way. You know it. You did your research beforehand, you know it. And then you're like, okay, what should my target be? Well, let's say between that minimum plus minus 5. So in my case, from the research that I did, I knew I needed something between a 240 and a 250. That's what I needed to be in. and hopefully get 245, like my mentor. He also got that. So that was kind of the goal in my head. You always work, obviously, for the highest possible score to achieve, but you really have to come in with a strong idea of what you need. Once you know what you need, you prepare for that. You bridge in the gap in your study, you do your question. And then comes a time where a lot of people will ask other students that took the step one, when can I go take my exam? You have obviously that date which you set, but your NBMEs and your self-assessment should correlate with the actual score that you want. If you took 2 NBMEs and there were, let's say, 236, 238, and you want above 240, it's actually a really bad idea at that point to go for your exam, because you're not at your minimum score. And guys, the prediction of the NBME is plus minus 10 points. You shouldn't take an NBME and see a score like 252. That actually will induce you in making errors. You should see your NBME as it is, an evaluation, and it is a range. So if you get to 50, the report will show you will probably score, if you were to take your USMLE exam in 1 week, between 242 and 262. That's what an NBME is telling you. An NBME is telling you a range where you can expect your results to be. And sure, you can hold that on your exam day, you have great question, or you perform excellently. That's what I wish for everybody. But you have a giant question bank, which is the actual USMLE question bank, which nobody has access to. And on your day of exam, you might get questions you're more familiar with. Like in my case, the pharma was great. I had some really shitty cardiology question on topics I was weak in. That's life. I remember Chris also called me after exam, and he told me that his biostatistic was really weird questions. So the point, so the point is, on your exam, guys, you might have easier or harder questions. There's a bit of luck there. There's also how much energy, how much focus do you have? So really bear that in mind. So if you aim for a minimum of, let's say, 240 or a minimum of 230, you want your NBMEs to be above that. You want to be in a safe-ish margin. If you were aiming for a 245, you would want your last 2 NBME to at least be a 242 and a 252, so that you can see that your NBME are in between the score that you want to target. And that's gonna actually not make sure, but it's gonna give you good indication that when you take your exam, you'll probably be in there. Because again, it's plus minus 10. That's just statistics. And Chris and I, we could, let's say, talk to you about, yeah, well, maybe you don't need to have exactly in between the score you want before you take your exam. Sure, but there are statistics in the end. There is everybody that take their USMLE exam. The NBMEs are statistics from people that have been taking their exam for years. And they're telling you, look, man, you took your last 2 NBME, this is the range you can expect. So be prepared for that. I think it's very important to be realistic about that. And so I did my Kaplan Q Bank. That was 2,700 questions. And I did the UWorld. Chris, you might just. So I think the one thing I regret probably is not finishing my UWorld. But again, if you do something like the Kaplan Q Bank, it's pretty much 2,800 question. Then you do another 3,000 question from UWorld. If you do something between 3,000 to 500,000, to 5,000 questions, you're probably in a good zone. That's what the Kaplan advisors recommended me. If you decide to go with Kaplan, that's what they're also going to tell you. And you build your way up. That's the thing that's very important. And the last 2 things I want to mention is about UWorld self-assessments. UWorld self-assessments are really good to give you an idea of your knowledge and also to practice for an actual exam. But the Kaplan advisors will agree with me. A lot of people on Reddit will agree with me. The UWorld self-assessment is more a practice test than a predictor, because as Chris said, it's plus minus 10, even plus minus 20 in a lot of cases. So honestly, I would definitely not base my score on the UWorld self-assessment. That's just insane. In the end, I ended up scoring the 245, which is what I wanted. based on the prediction I made and needed with my NBMEs. So just keep that in mind. And I think that Chris and I can wish all of you the best of luck on your exam. And now you have all of the different links of the resources we mentioned. So you have the ECFGM, that's where you will go to create an account, to sign up for your USMLE exam. You have a link for the UWorld. So again, we suggest you do that in your dedicated study time. If you can only do one QBank, you do UWorld. That's just a go-to. You have a link for Patoma, Sketchy. Anki Palace will teach you how to use Anki if you don't know how to use it, because I'm awful with technology and I had no idea how Anki worked at the beginning. So that's a great place to go. Med School Anki will have all of the decks that Chris and I have been talking about, because I'm sure a lot of you even forgot the names. That's fine. Go on that link. You're going to have all of the different Anki sets that you can download with good explanation of how to use it, what is included in each deck. So that's a great place to go. USMLE.com, it's a site that you can pay for pretty much for private tutoring, group tutoring. If you don't want to do that, that's fine, but their flashcards are honestly amazing. It's the most high-yield material that I used, I can tell you that. And you have a lot of great articles that will walk you through how to come up with a study plan, how to answer questions step by step. So I think it's a great free resource to have a look at. And then lastly, you have that's captest.com, which I'm sure a lot of you know of. There you have all of the courses for Kaplan.
If I may just conclude also one thing, maybe we should have mentioned it at the beginning, but when you want to do this step one, now in general, you should also know why you're doing it, because it's a big hassle. You would take months to prepare for it. I wouldn't recommend anybody to do the step one if you cannot at least imagine yourself working in the US. I mean, there are a lot of upsides and downsides in working to the US, so it's a very individual decision. But just doing the step one, just for the sake of doing the step one, I would not recommend to anybody, because it takes a lot of time. And it's also from a financial point of view, which is often neglected. And you will see that, and I just really saw that once I prepared for it, it's really big. Because for me, I paid like 1,500 euros for all the material for the registration, because the registration alone costs 1,000 euros. And then you have to add up like all the material that you're going to buy. There's no free UWorld that you can get, and it costs like 300 euros and all the other materials. So I paid like 1,500 euros. The other steps cost also money. But again, I don't want to say this to demotivate any of you, but I just wanted to put it also into some realistic frame. You should know what you're studying for and why you should studying for it, and you should have your reasons for it. I think José and we just showed how we studied for the step one, what we did. We believe firmly that these scores are totally reproducible for anybody, and you can even score much higher if you just follow what we did. Of course, it's individual, but at the end, the same principles will occur. So if, for example, if somebody here wants to score 270, the only difference that I would do is starting earlier with questions. I would do the whole Kaplan before, in addition to all the things that I did, and then do the UWorld, and then probably I would have a higher score. So what I want to say is you have seen what we did, and we told you what we did right and what we think we did wrong, and you can use that information now to your advantage. I think right now we can conclude this seminar, but we want to leave it open now for some open Q&A, and you can ask us questions. You can also, I think you can also turn on your microphone to ask questions. In a second, let me just finish this presentation, and then we can do it.